Hi, and welcome to the Veterans Corner. My name's Chuck Wood, and I'll be your host. We have a very special guest with us today, Dr. Jeanne Folks. Dr. Jeanne Folks is going to be talking about PTSD. PTSD is an issue that we've had on the show before, a topic, I should say. And as important as it is, we want to make sure we want to bring Dr. Jeanne back, or here rather, and discuss more about PTSD. Welcome to the show.
It's great to be here, Chuck. Thanks for having me.
Before we get going, what I'd like to do is I'd like to read your bio to the viewers. Let me put my reading glasses on here. Dr. Jeanne Folks is a licensed professional counselor and is a clinical director of the Connecticut Psychotherapeutic Resources in Avon, Connecticut. It's a private practice dedicated to the treatment of psychological trauma. With 36 years in practice, she sees individuals, couples, and facilitates groups. She is a national workshop presenter, blogger, clinical consultant, and forensic expert. Jeanne has also taught as adjunct professor of psychology at Central Connecticut State University over in New Britain, and is a clinical instructor at the University of Connecticut School of Medicine. Jeanne is a EMDRIA approved consultant, and we'll be talking more about
I strongly suspect we will.
Those letters later on. Has advanced training in emotional freedom techniques, and is a master ART clinician. She is appreciated by clients, students, and consultees alike for her insight, skill, and warm, good humor. Jeanne, welcome.
Thanks so much, Chuck.
It's great to have you on the Veterans Corner. Would you like to talk to the viewers first?
Yeah, just really briefly. We are going to be talking about PTSD, and I just want anybody to know who is suffering from PTSD. Some of the things we talk about tonight could be triggering. So I just want to really encourage you to take good care of yourself. If in the course of our conversation, as I'm describing symptoms, as I may be using some examples of how PTSD can happen in certain people, your heart starts speeding up, or you have other symptoms that are making you really uncomfortable, I encourage you to turn the sound off for a minute, take a couple of deep breaths, then turn it back on again and see if you've settled down a little bit. If you don't, then you may want to turn the program off, push record, save it for later, and watch it with a friend. And then if it's recorded, you can stop and start and manage any reactions that you're having. But I want you to feel safe, and I want you to take good care of yourself.
Yeah, thank you. That's great advice, Jeanne. You know, this is a Veterans Corner. We talk about a lot of veterans issues, and this obviously is a major veterans issue. But it's not just for veterans. I mean, anybody could have it. What can you share with the viewers what exactly is PTSD?
Yeah, you're absolutely right. PTSD is not a respecter of persons. Yeah. It is a respecter of human experiences. And PTSD is a group of symptoms that are strong, often chronic, and are very, very hard to get past, although it is absolutely possible, and one of the messages tonight is that there's hope. Yeah. But PTSD has several categories of symptoms, and we're going to be going through them all. The first is intrusion, avoidance, physiological hyperarousal, and cognitive dysregulation. So those are the 4 categories in which symptoms can occur in PTSD. And the overarching criteria is exposure. Yeah. You have to have had an experience in order to have PTSD. Now, the kinds of experiences that can cause PTSD are wide and varied, but there are themes in any exposure experience that will possibly result in this constellation of symptoms. Now, not every traumatic event causes PTSD, but there has to be a traumatic event for PTSD to happen. And one of the hallmarks of PTSD exposures is a sense of being entrapped or feeling helpless. You are in a situation where you feel either physiological and or psychologically in threat of losing your life. You have that sensation of, I could die in the next moment. And it's not just physiological death, but it can be psychological or emotional death. And when there is that experience of being trapped and not being able to get away, then our bodies go into a profound state of emergency. And we've talked a lot about PTSD and fight and flight or freeze. But our bodies are built to actually take our thinking brain offline to save time and go into pure animal instinct. And we are flooded with stress hormones, and we are ready to fight, to flee, or in the worst case scenario, to freeze in place, because we only do that when we feel like all hope is gone and whatever I'm facing outside myself is so much bigger than I am that simply holding still and playing dead is my best shot.
A lot of people don't realize that. You hear it over and over again, the fight or flight.
Right.
But most people don't realize that there's a third component, the freeze part.
Absolutely, and that shows up in the symptoms a lot. People will say, I just felt frozen in place. I felt stuck. I couldn't move. I couldn't speak. I couldn't do anything. You know, everything was shutting down. And that is those stress hormones, you know, at work in a person's body. So just to think of some examples, because it's so easy to understand how a combat veteran, a first responder, somebody in obvious life and death situations with bullets flying could, you know, have PTSD, but there are all kinds of other situations. Traffic accidents, physical assault, childhood abuse. There are even certain kinds of circumstances. I worked with someone recently who had been stalked and was feeling unbelievably unsafe and became so hyper aware of circumstances and fearful that those symptoms embedded and entrenched. PTSD is all about safety and survival. And when you understand that, you know that PTSD is not crazy. PTSD makes all kinds of sense. And the body is trying to help us survive by turning the brain off, getting our bodies to function in pure reflex, and to hopefully survive a situation that doesn't seem survivable. So that in a nutshell, I think, is PTSD.
You had mentioned, you know, first responders like police. I mean, you've also got EMTs. Absolutely. That EMTs and bullets flying by them, although there might be cases where they do.
Right.
But there is that same traumatic, you know, response each call. You never know what you're going to, you know, stumble into. Right. And you have people's lives in your hands. And it's events like that that can also cause it. Now, is there more than one type of PTSD? There is. There's two primary types of PTSD. One is called discrete trauma, which, you know, that
word may or may not make sense to people, but if you just think about it as type 1 trauma, it's an event that you can circle on a calendar.
Yeah.
It happened at a particular day, a particular time.
One time.
Usually one time, yeah. Somebody's standing on the sidewalk watching their house burn down, and they didn't know if one of their loved ones had gotten out or not, because that's another piece of PTSD. We can get PTSD from seeing a life or death situation of a loved one, and it will have the same effect if we feel the helplessness and entrapment of not being able to escape.
Yeah.
But in those situations, your life may have been going along pretty well up till then. Then this event happens. A particular battle that you're in, a car wreck, an assault, a terrible event takes place. And then after that event, you start becoming very, very symptomatic. And you don't understand because you say it was just one day in time. But that event could completely dysregulate your physiological responses from then on. Unfortunately, our bodies are hardwired to remember fear.
Yeah.
And the reason is that the body doesn't want us to forget in case that bad thing ever happens again, and our system's not taking any chances.
Yeah. It's protecting itself.
It's protecting itself and being ready to protect again if a similar circumstance showed up. The second kind of PTSD is chronic PTSD. The most common form of chronic PTSD is abusive childhoods, where similar things were happening over and over and over again for sometimes many years.
Yeah.
And there's often, with veterans or first responders, there can be a combination. There can be a discrete trauma that I'm going through really tough things all the time, but there was a certain day under certain circumstances that, something was different about that time. But then the chronicness of similar things continuing to happen, then the person winds up with both type 1 and type 2 PTSD. Type 1 PTSD, believe it or not, even though the situations can be egregious, is a little easier to treat because you have a lot of time predating that event that the body remembers is okay.
Yeah.
So you can help the system recalibrate because it has a reference point. With chronic PTSD, especially if childhood trauma's involved, a person may not be able to remember back to a time when things were good, when things were normal. So there isn't the same reference point, and that treatment can still be effective, but it usually takes longer.
Yeah, these occurred during their developmental years, and like you said, that's all they know.
It's all you know. Yeah.
What are some of the symptoms? I mean, as far as we talked about the exposure, intrusion, avoidance.
Right.
What are some of the symptoms of PTSD?
Right. So let's go through these categories. The intrusion symptoms. Those are the symptoms. When you think of an intrusion, it's something coming in unwanted. So nightmares, flashbacks, night terrors, all of those unwanted, uninvited images, sensations, sometimes smells, sometimes sounds that can come in an instant. You're just fine and minding your own business, and all of a sudden, wham.
Something triggers it.
Something triggers it, or it can just show up.
Yeah.
The mind is so committed to, don't forget this horrible thing. Don't forget, because you might have to survive it again. And I'm trying to protect you, and I'm not taking any chances. But then it makes life unbelievably difficult and challenging. And further destabilizes the person, because then they just never know when a flashback is going to hit. Am I going to be okay? Can I go to this birthday party and behave like a normal person? Or am I going to be, someplace else in my head trying to manage that and look okay on the outside?
And that obviously increases the anxiety levels.
Huge. Absolutely.
You're anticipating that to occur.
Yeah, and then you are so afraid of these intrusive symptoms that they actually increase. Yeah. And then the train has really left the station, and then we need to do things to interrupt that cycle. So that's intrusion.
Okay.
Okay. Avoidance. The avoidance symptoms are kind of the polar opposite of intrusion. Avoidance symptoms have more to do with not knowing, possibly even not remembering, or remembering just tiny bits and pieces. It can be, I just can't drive down that street, because if I drive down that street, then I'm going to see that house and where that bad thing happened, and I can't go there. And the other symptom that comes into the avoidance category is dissociation. And I want to talk for a minute about what dissociation is, because that word confuses people. Now, dissociation is different from disassociation, and people get confused about that.
Yeah.
When we disassociate, for example, somebody tells some terrible racist or sexist story in a meeting, I get up and leave to disassociate myself from that behavior. I'm saying, I am not going to stay here and act like your behavior is okay with me. So I'm going to disassociate myself from what's going on. When we dissociate, we're getting up and leaving ourselves internally. We are saying, inside of here, what I'm feeling and experiencing is too much for me to handle, it's unacceptable, and I'm not going here. So when we dissociate, we can go physically numb, we can go emotionally numb, we can, when it's severe, actually lose track of time and suddenly look at the clock, realize that 3 hours have passed and you don't know where you've been or what you've been doing. You've probably been staring at a wall. Yeah. Or, believe it or not, sometimes, walking and talking and people said you were fine, but you weren't showing up inside your own body to be present for life. And so those are the avoidance symptoms. And then the physiological hyperarousal. And we see this a lot in vets. That's the anger stuff, the rage, road rage, punching walls, just having this sudden flood of anger. It's not always physically violent. It can be verbally violent, or it can just feel, you're so angry you just feel like your head could explode. Yeah. And you have to remember that one of the things in fight or flight that all that adrenaline does is get us primed to go to battle, to fight for our lives. And when that's dysregulated, our bodies will just do it then at random times to try to be ready to fight. Only sometimes it's happening in really inconvenient and inappropriate times in the here and now.
Yeah. It just kind of flares up. And
right.
Most of the time when where you don't want it.
Super inconvenient.
Yeah.
Yeah. And then cognitive dysregulation. There is a group of symptoms with PTSD that looks a little like a learning disability. People have trouble, who never had it before, concentrating, focus, keeping your train of thought, word retrieval. The word was it was right there just a second ago, and I knew I was talking about something that
I thought that came with age.
Well, that too. but this is a little bit more extreme, and it can put jobs in jeopardy. it can make life incredibly difficult. So, you know, we want to really pay attention and realize that we can have a variety combination of these symptoms. Some people's PTSD can be more clustered in one spot, and some people may not have any of one and a whole lot of several others. So in that sense, it is unique, but we're going to see some combination of all of those symptoms.
Can two people experience the same event?
Yes.
The similar experience, one gets PTSD and the other one doesn't?
Yes.
Does that happen a lot?
It does. We bring everything we are to any life experience. We bring our whole history. We bring our physiological predispositions. We bring our DNA. We bring everything. Some people are just more impacted by experiences than others. Some people dysregulate more easily than others. And one of the things we know from the research that really began in a big way in Vietnam during that era is that people who have had trauma in childhood are more vulnerable to PTSD.
Yeah.
And because the body recognizes a new trauma and attaches it to old trauma, and that makes the reaction stronger. And then there's an element of mystery. Why someone can go through something dreadful and, you know, come out of it seemingly pretty okay,
yeah.
And others don't. But it's really important that people know that it is not a lapse of character, yeah, or a lack of strength that contributes to PTSD. Anybody can be vulnerable, anybody can have it, and there are a lot of good things that we can do about that.
I mean, the next time around, if those two individuals are in the same, you know, stressful situations in the future,
right,
it could be completely opposite. The person, right, that didn't get it the first time can get it the second time, or will get it this time.
Right. Right.
You know, what makes PTSD symptoms worse or better? I mean, is there anything that would, I mean, that...
A number of things,
yeah,
and it's a great question. Some of the obvious things that people don't think of as obvious until they hear them, but stimulants. You know, remember that PTSD is about a dysregulation of stress hormones that are already too high. So if you add caffeine and sugar and a lot of other stimulants, that's not going to help the situation.
Yeah.
Crowds, stress, noise, anything that makes your heart speed up and makes you feel stress can exacerbate your symptoms. People with PTSD do better in controlled environments with access, at least, to peace and quiet and solitude, and to have the respect and understanding of the people in their lives to give them space when they ask for it.
You know, it could be somebody that doesn't even know they've got PTSD, and they're sucking down 2 or 3 extra large coffees a day, not even realizing, yeah, that they're just...
with a shot of booze,
yeah,
in,
yeah,
you know, just to help it along. Yeah.
You know, I got to tell you, there's so much information here that we could be talking about. Would you be willing to come back for a part 2?
I'd be delighted. Yeah, there's a lot more to say.
There was a whole other section here that we wanted to talk about as far as, you know, what kind of treatments and stuff like that.
Right.
So let's plan on that.
Absolutely. There is help and there is hope, and that's what we're going to talk about next time.
Yeah. With that being said, I'm getting the 1 minute. Actually, we're probably down to about 30 seconds right now. So I just want to say thank you very much for being here. Another very, very informative show here at the Veterans Corner. It was great to have Dr. Jeanne here, and it's going to be great to have her back. So with that being said, you're watching the Veterans Corner. My name's Chuck Wooden. Have a good night, and thank you for watching.